Morning. It's day 4 post-op, Saturday. Just waiting on the residents to make their rounds. They come by a little later on weekends, so I'm waiting on them to see what's going to happen today. The tentative plan was to send me home at some point today. I don't think that's changed, but I don't really know. Yesterday afternoon, they transitioned me to the low residue diet. We skipped over full liquids and went straight to the low residue diet, which is the same as what I was on after my first operation. It's just really low fiber, bland, not very exciting, but easy on the system diet. Um, and as a result, I started having my first bowel movements. A lot of them. The first meal, I had a couple or three or four within an hour or two. And then it was kind of quiet. And then I had dinner, and it was actually kind of quiet for a couple hours after dinner. So uh, thought I was lucking out, and it was going to be a piece of cake. But then last night, I was up probably at least once an hour to go to the restroom all night. So probably 7 or 8 throughout the night. Not particularly painful, not like being sick on UC or, not blood, not tremendous discomfort, but just a lot of frequency and not great consistency. Um, as the night went on, the consistency seemed to improve, which I think is good, but the frequency is still there. I'm told, and I know it'll decrease over time, but frequency will decrease and the consistency will increase, and all that's good. But for right now, it's not great, and not sleeping through a night is not pleasant. But so we'll talk to the doctors about that. But I assume they're just going to tell me that it's going to get better and to hang in there. My pain is. They also transitioned me off of IV pain and IV steroids yesterday. So the oral steroids seem to be going fine. The oral pain is a bit of an issue. There's still a lot of pain or a good amount of pain around my incision site. Um, and the oral meds just don't have the same effect as the IV meds do on it. It's not unbearable or crippling or anything, but it's definitely discomforting, uncomfortable, and they're trying to figure out what to do. We may try some topical um, stuff today, or we may just stick it out with. They have me on oxycodone and ibuprofen, and we may just stick it out with that for a few days, and hopefully it'll get better. The wound itself seems to be healing pretty well, so it's hopefully just a matter of time. Um, that's really about it. So I should be getting breakfast here in a bit and meeting with the doctors in a bit, and I should know if I'm going home later today. If I had to guess, I'd guess they'll keep me at least through lunch. Since I've only had a couple meals so far, I'm sure they'd like to see a couple more. Um, but that's really it. Hopefully, I'm going home, and I'll continue to improve. I'll update you later.